Hello everyone, my name is Amy McMullen and I'm a health justice activist, and I'm here today to talk to you about Arizona Governor Ducey's Medicaid modernization proposal. What this essentially is the governor is attempting to make changes to our Medicaid system, known as access. The process takes a year and has to be approved by the federal government before it goes into effect. So this is a very important time for us to be talking about this. Now, looking at the proposal as it's been sent out from the governor's office, we see that there are some catchphrases like choice and accountability and responsibility and engagement. But once we look deeper into these words as they are defined in the plan, we see that this is really an attempt to make healthcare less obtainable to the poorest Arizonans. This plan includes things like strategic copays and premiums that will require participants to fork over up to 5% of their income to receive care. There are penalties involved when appointments are missed or emergency room visits don't result in admitting to the hospital. Now, there's many valid reasons to go to an emergency room that will not result in an admission to the hospital. This plan also talks about personal responsibility, and by personal responsibility, we mean that if you do not meet your premium payments, there will be some dire consequences. The consequences include being kicked out of the program for 6 months or becoming a debtor to the state, and we're not even sure what that means. The premiums that the poorest of the poor will need to pay will be placed into HSAs, which are health savings accounts, and these will be used for uncovered services such as dental or vision. Here's a thought. How about we have Medicaid pay for dental and vision? Because they're important. There are incentives for healthy behaviors that essentially require participants to reach their health goals, and work incentives that require so-called able-bodied to work or attend school. And it's all linked up with some truly draconian laws that were passed during the last legislative session that limits the lifetime use of Medicaid to 5 years. And it also removes travel vouchers for the poor to get to their appointments. You remember those appointments that you're going to get penalized for if you don't make it? Throwing up barriers to primary and preventative care, as this proposal appears to do, will only cost the state more, as more people find themselves using hospital emergency departments for their primary care provider. This is a practice that has been proven to increase mortality and morbidity in vulnerable populations, and it's very expensive. Pardon me for being blunt, but forcing people living at or below the poverty level to fund HSAs is a joke. Disenrolling people from access because they cannot afford mandatory premiums and HSAs contributions is the antithesis of providing health care to low-income populations. And choice? There's some pretty terrible choices. Should I pay the rent this month, or should I fund my HSA? Should I fix my car so I can get to work, or should I fund my HSA? I mean, really? For a program that purports to be a bridge to independence, this will achieve exactly the opposite, as the poor are penalized and guaranteed to not get ahead. Limiting the use of Medicaid to 5 years in one's lifetime, I don't care if you have diabetes, you're done. This is short-sighted and cruel. Poverty and disease do not have an expiration date. Throwing people off just because their time runs out only ensures that there will be sick people without needed access to care. This causes a burden in the hospitals and the care providers, and it's devastating to the affected individuals and their families. So instead of trying to find ways to cut access to health care in our communities, why isn't the governor working on ways to increase availability to those in need? By hiring more staff to reduce the applicant backlogs, or incentivizing providers to take more access patients. So I will be actively working to oppose any and all changes to Medicaid that do not serve the common good by expanding access to health care. And I'm urging you to join me. Please write to publicinput@azahccs.gov, and I'll repeat it. publicinput@azahccs.gov, and tell them what you think about this mean-spirited plan. Thank you for listening, and please share this with your friends. Together we can ensure that all Arizonans have access to health care. Peace out.